Welcome to another episode of On the Mic with Ed. You are here with myself, Maria Ortiz, and co-host Dr. Zoe Ross-Nash. We also have an awesome guest with us today, Eric Pothen. He is an eating disorder recovery coach and current grad student. We are so excited to be talking all things eating disorders and men. So really, really grateful for this episode. Very, very grateful for Eric coming on and joining. He has a very, very needed perspective on this topic. So we are so thrilled to be doing this today.
Yeah, thank you so much for having me. I'm really looking forward to our conversation.
Yes, and Eric, I just wanted to congratulate you. Were featured on Project Heal about eating disorders in men. That is such an incredible accomplishment. And
Yeah.
as Maria said, wildly important.
Thank you. Yeah, it's a really important topic, I think, for us to be talking about. And the article that I wrote for Project Teal was really all about how do we begin to see outside of that swag stereotype, skinny, white, affluent girls and women, right? When it comes to those who can struggle with an eating disorder and really beginning to paint a more realistic and accurate picture of just, the landscape of what eating disorders can look like. So, yeah, I loved writing that piece.
Well, let's just jump right in as we debunk with that swag stereotype. I would love to hear when you first started to struggle with food and exercise in your body, just what was it like? Did you even recognize it as an eating disorder at the time?
Yeah, so the funny thing is when I look back at my entire journey of struggling with an eating disorder, the two words eating disorder never entered into my mind, not once. Um, I think for me, I was just struggling with my body and overexercise. And thinking about what was going on around the time of my eating disorder and the onset, there were a couple of major things that were happening. One is I was graduating from college, so thinking about a huge major life transition, and feeling really stressed about entering into the real world and having my first full-time job. I had some friends that were moving out of the state that I grew really close with over college and was just feeling really sad about that. And then also at the same time, I was really struggling with my sexuality as well. And so the two of those kind of created the perfect storm, as I like to say, or another kind of image or metaphor I like to use is a Jenga tower, and how I think a lot of these things were adding up and starting to build up for me personally. And just it was really those two final things that were just pulling those Jenga tower pieces out where it got topsy-turvy and kind of collapsed and started to immerse myself into yeah, struggling with food and with body image a lot during that time.
That makes so much sense because with the research that I've done about men and eating disorders, the three main catalysts are transition, self-esteem, and bodily function. So I think we immediately think of young boys or adolescents as being a risk factor, but really transitions is a really big one that clinicians and people should be looking out for.
Mhm.
And
Yeah.
transitions even emphasizes the idea of being older too. So we've talked about the stigma on our podcast before of like this being like a young disorder or something of that nature, something that adolescents grow out of. And I think what you're identifying is like one, any presentation. I love the term landscape because if you like drive through a neighborhood, the landscaping is going to look slightly different for everybody, even in the same neighborhood. But I think it's really, really important that transitions occur at later age. Feeling out of control does not just go away just because we got older or more mature or in college, whatever it is. It's okay to feel out of control, but I wish that you kind of maybe had some more resources. I'm hearing this undertone of it doesn't sound like you had direct access to understanding what was going on at the time. And this hindsight is what's giving you sort of that picture.
Yeah, absolutely. And I think one thing too, before I respond to that, is transitions not only from, major life events, but I think two transitions in identity, right? I'm even thinking of, I feel like what's starting to get more attention is, mothers really struggling with eating disorders. And my mind goes to, okay, let's talk about that identity transition, especially if they have kids that are moving out of the house for college and then they're empty nesters. So how do you cope with those emotions, right? And that part of your identity that maybe is getting lost in that transition and finding yourself again. And so my mind just gets curious about what that can look like too for just all people in terms of maybe identity transitions and challenges they may be experiencing. But yeah, I think Maria, to go back to your point, is I never received help for my eating disorder when I was living with it. I lived what with anorexia. I'm very intentional with those word choices, lived with, instead of I had anorexia. Just it creates separation from myself and the eating disorder. But I lived with anorexia for about 2.5 years. And not once during that time, as I mentioned, did I really consider myself having an eating disorder. But what I got wrapped up so heavily in those years of struggling was this intense amount of praise that I was receiving for the changes in my body for so long, for so many years of my life, starting in middle school. The label of being gay was placed upon me. And so that was something that was given to me before I had the chance to do that for myself. And I didn't come out till I was 27, and I'm 32 right now. And so thinking about, graduating all the way, I mean, graduating from college at 22, carrying this label with me for 10 years, feeling a lot of shame and guilt and struggle with that part of my identity. This was one of the first times in my life where it felt like people weren't attaching that label of me being gay, and they saw me as something other than that. They were paying attention to my body in the way that my body was changing in my overall appearance. And so for me, that felt so intoxicating to have the attention be on something else other than that label of me being gay. So that was really what fueled the eating disorder, was just this intense amount of praise and just this like overall sense of relief of just being able to like let that part of me that I had been carrying on my shoulders for so long, I was able to take a little bit of that load off during that entire time as well.
That was Zoe and I kind of, I can tell on our faces, that was a really like eloquent explanation of kind of what you've gone through. And I know there are listeners that are going to be able to relate to that story, which breaks my heart, but why I'm very grateful that you're sharing yours. I'm also hearing this overarching, the eating disorder allowed you to control your own narrative. The eating disorder let you pick an identity of whatever it was around food. For once, they were talking about something that at least you felt like you had control over. And it sounds like certain labels that were thrown at you prior to you wanting them to be stated. I think anybody would kind of crave that sense of control over themselves, their autonomy, and how they're perceived. You bring up important aspects relating to identity. So I'm curious to hear kind of like how what messaging that you heard about being a man or other identities of that nature influence your experience with the eating disorder and even how long it stayed, how it presented.
Yeah, that's a great question. I think growing up, I lived in a pretty, I think, a safe household to express my emotions, which I feel like maybe isn't what the typical experience is for men in general and young boys. I think when we think of what it means to be a quote unquote man, right, from a more traditional perspective, and I do man in air quotes because I think it, it deserves some reflection and criticism in that way. But when you think of that, my mind goes to like, don't show any emotion. You can't struggle. Be strong. Be tough. Keep it together. Don't be a burden. A lot of those common messages I think that men receive. And if you do anything other than that, you're viewed as weak, right? You're maybe viewed as being quote unquote soft or more girly or feminine in those regards. And you don't want to be seen as a failure. And so I think for me, all throughout I was struggling, I think one of the biggest things that kind of kept me stuck in the eating disorder was just, I think, my own lack of awareness that what I was struggling with was an eating disorder because when I was in school learning about eating disorders in middle school, I didn't learn that men could develop an eating disorder. So I think there was a couple of disconnects. One, that was a really big part of it. I didn't know men could develop an eating disorder. But two, also, I didn't want to be viewed as weak. I didn't want to be a burden. Also, when I was in middle school, my mom had received a liver transplant and had some medical complications after her procedure, which my brother was in college at the time. My dad would go straight from work to spending time with my mother in the hospital. And so I would be kind of passed around from friend's family to friend's family. Um, and really, it was during that time that reinforced this notion too of don't be a burden. Just kind of don't make noise, just be grateful and stay in your lane, essentially. And it's so interesting. So people, when I think of eating disorders, I don't think enough people realize how complex they actually are in nature, right? And so I think for me, even making that connection now, I don't think I've ever made that connection in previous conversations I've had, but just how this narrative that was reinforced in middle school of being a burden became immersed with the narrative when I was living with my eating disorder. Deep down, I knew I was struggling, but there was a part of me that was felt a lot of shame and guilt to admit that struggle, which, kind of goes back to what does it mean to be a man, right? And to not want to externally show that you're failing or struggling. I'm a perfectionist too. So add that into the mix, and I hate to admit failure and to not do well at something. And I just think it's all of these things that are coexisting and interacting with each other in such unique ways that really kept me stuck.
Wow, Eric, your story is so profound. And I know you are not the only one with a story similar to this because men are told that they should be stoic, they should be strong, they should be disciplined, they should be in control. And a lot of the ways eating disorder pathology provides that, and it gives rules, it gives structure, it gives understanding, it gives meaning. And as you were talking about this intersectionality of health, I was thinking we have this episode called like On the Mic with Your Inner Eater. And now I want to do one called like On the Mic with Your Inner Identity and how our identities hold these generational wounds. So, from my understanding, as a result of the HIV epidemic within gay men, they began to use eating disorder pathology related to exercise to appear strong, to appear healthy, to mitigate the stigmas associated with being perceived as ill, being perceived as contagious. And I just am seeing this underlying identity that you had, whether you were conscious of it or not. Either way, it was placed on you during middle school. How this all manifested into the pathology of an eating disorder. Um, a question I like to ask my clients is, how come an eating disorder? And sometimes they don't understand why, especially because I work with the intersection of trauma. And then when we look back on these societal lenses and these intergenerational lenses, we're able to identify the vulnerability. And that just really put a lot of pieces together in my brain.
Mhm.
Yeah, and I also think I want to point out you mentioned this idea of like don't make noise. And I really, really love this Project Heal win for you because you are making noise about this and you are sharing your voice. And when you said that, I was like, oh, he's speaking now. So I think that that's really, really awesome. I also think there's this emphasis on middle school, and I think that's kind of when this all hit. I feel like this was probably placed on you prior to your awareness even of it. And yes, for everybody who's not seeing us right now, we've all actually, when we said being a man, we all used air quotes. Um, and I think that's really, and there was actually a couple eye rolls from my side of just, yeah, this language that is stated that it's very, very sad. But I'm really glad to hear you kind of discussing it because, yeah, it's like you don't want to be a burden and you can't be weak and you can't be quote unquote too girly. But then also on the flip side, men also get, kind of some bad language around being too macho or now they're not in touch with their emotions. And I'm like, well, which one is it? Which one do we want? Because it sounds like right now, neither extreme is acceptable. So there's this tiny little fine line that feels a bit impossible.
Yes, absolutely. And I think that's why I am so passionate about doing the work, this work for this indoor eating disorder work in the space of men, right? I think not only raising awareness around the male experience of living with an eating disorder and that, genders other than women and females can live with one. But also, too, I think my hope in this work is to begin to redefine what it means to, healthily express yourself as a male, right? And being okay with leaning in to vulnerability and that it isn't a sign of weakness. Right. In actuality, it's a sign of strength. And thinking even just about language, right? I think that's a really important thing to talk about when we enter into the space of men and eating disorders, because I think the typical language that currently exists when we talk about eating disorders, I think can leave a lot of men out of the picture. And so I think it's important to name that as well, and finding ways that we can create nuance within the language that captures a more realistic picture of the male experience as well.
I'm curious to hear what surprised you most when you did start talking about this with people.
Yeah, I think the thing that surprised me most was just how many people have had their own challenges themselves with an eating disorder or disordered eating or just poor body image. When I shared my story, it was during COVID, and I just felt this really big, strong pull. I was doing a lot of, deep healing during COVID, as a lot of us, I imagine, were as we were faced to, with our own inner worlds a lot in isolation. But that just I felt a really strong pull to share that, and it was really the catalyst for me to continue healing actually in the space of my own eating disorder recovery. And at the same time, I think it just opened this door for me to be where I am now, of, being back in school, studying to become a therapist and advocating and being an eating disorder recovery coach. But, really what I learned in this process was, and I think this is lays the foundation for a lot of the work I do, is I think the more that we can honor and embrace all parts of our story, who we are as individuals, it helps us release the shame and guilt that's attached to it. And ultimately, what that does is it opens doors for you and other individuals to really live their most authentic life. When we can remove some of the baggage and take some of the weight off of our shoulders of carrying that for so long and letting it have so much weight on us, where we can finally breathe and be like, okay, I can honor and accept that this was a part of my journey. It will always be a part of who I am at the core, but I don't have to let it define me. It can be a part of me, but it is not me. And that's why I like to use the phrase, I lived with an eating disorder. And so it's so fascinating, I think, what this journey has brought me on here of just, I think it has allowed me to just be me. I came out, around the same time of sharing my story, of living with an eating disorder. And I didn't realize how many people needed a space to land, right? That needed a space to feel seen and reflected. And that's what encouraged me to dive deeper into the advocacy work as well. But it really caught me off guard and surprised me just how many people, as I said right away, have their own experiences with an eating disorder or disordered eating overall.
Something you also just pointed out there is a lot of times as you go through the eating disorder recovery process, you come out kind of as a different person, and that's not always a bad thing. So I always say some people kind of return to themselves. They kind of go back to who they were prior. Some people are a morphed version. Some people are very different because they have finally found freedom in just existing as who they are. They are existing in an authentic manner, and that might look very different than prior. And sometimes that can even be jarring, maybe for families. They feel like, this person has changed. I'm like, yeah, they're finally existing in realness and who they wanted to be all along. Um, and I love the term lived with. in the sense of, yeah, lived alongside. And I love even like the past tense of that as well, showing the possibility of after. As we've been having this discussion, I did not think of this prior to the podcast, to be very honest. But I've just recently thought of a few different books or manuals that I was reading this past year. And there are a few that I'm thinking of that use the term she and her throughout the entire book. And
Mhm.
sometimes it's even referenced as like for ease. And I really just am thinking about that bias of when we're reading she and when she is underweight and when, when we talk to her. And Zoe and I, whenever we're doing an article or anything, we use the individual. We use like we use inclusive language on purpose, but it's even in our literature to be highly skewed towards a female presentation.
Maria, I am so,
Yes.
go for it, Eric, sorry.
Oh no, you go for it. Yeah, I think I want to let you finish. Yeah.
I'm just so glad you said that because 1 out of 3 people with an eating disorder is male. Let's full stop there. 1 out of 3, which is 25 to 33% of cases. So that is a huge chunk that research is neglecting, clinical work is neglecting, advocacy work is neglecting, and these people are significantly struggling. And I think marginalized identities and underrepresented experiences with an eating disorders, I think they're finally getting their reckoning. I think there was an emphasis on it at IADEPT at least 2 years ago. And I am just really glad you named that, Maria, because these, like, honestly, microaggressions that we see within research, it stops people from getting the support they need.
Yes. And this is something that I'm really passionate about as well. And as I mentioned, I'm currently studying to become a therapist, and even in my psychopathology textbook and in my developmental psychology textbooks. I mean, I think when I was reading the chapter on eating disorders, it was 11 pages until they made any reference to anyone other than a female struggling with an eating disorder. All of the case studies in the book were women, white women, skinny white women. And so the inner advocate in me, my blood began to boil because and even, I mean, I go to health classrooms to do an eating disorder lesson with seventh graders a couple of times a year. And even looking at their curriculum, the same messaging is reinforced. And so I just think you really hit the nail on the head when um, naming the importance of using inclusive language, right? And I think it creates more spaces for all individuals to see themselves as a part of the picture, right? Or that they themselves, can identify with this. Because I think that is so important. If you can see yourself seen and reflected, you're going to be like, okay, maybe what I am struggling with is this. If you don't ever see yourself a part of the picture, you're probably going to consider, well, this is what it's only been talked about, right? As opposed to, this is what it actually could look like. And so I just am so passionate about that as well, of how can we begin to create a widespread change and shift in the overall language. And that's so simple, right? Instead of just using she and her, like use the plural there or they, or I like how you say the individual. And let's remove gender from the picture because I think all genders can struggle with an eating disorder. Because if you were to remove all of that, it would still look pretty similar amongst individuals in a way, at least for maybe some of the behavior component. Of course, it manifests very differently within the individual, but I think all in all, it's really coming back to let's just name it for what it is.
I think a lot of the stigma that men face is a product of the DSM because back in the DSM-4 iteration, amenorrhea, which is a loss of menstruation, was required for the diagnosis. Well, if you're assigned male at birth, then you're not going to have amenorrhea. And I also think that it takes a lot of individuals who, one, either never got a period because they're too young or don't have a period because they're too old. So I just am glad that the DSM now 6 is going to be more inclusive, and I'm excited to see what comes out. So hopefully men can see themselves represented in the diagnostic criteria and get adequate and accurate diagnoses.
I think even too, yeah, that it loves to use like the terms of she and her. I also think though in the broader spectrum of how they're portrayed, it is skinny, white, straight women is also
Yes.
kind of a theme and also in probably the most acute state possible. And so I also think too that the literature even discusses manners in ways that it does feel like a microaggression because it's not that hard to shift language from yeah, she or him to they. So it does feel intentional. Um, and also, bless you, Zoe. And also, it makes me wonder how the research can be skewed too because men are less likely to seek help. Therefore, even so, like Eric sitting with us today, lived with, sorry, an eating disorder, and he never got help. So he's not even in the statistic of the 1 out of 3. And I remember the first training I ever received on men with eating disorders actually emphasized that they are less likely to get help, less likely to not be noticed once they're trying to get help, and 3 are going to usually get help at later stages and more acute stages.
Yes. And I think you named all really important things that I think continues to highlight why it's so important we continue to have conversations about this and begin to normalize and create safer spaces for men to land, right? If they are finding themselves struggling. One of the things that I find most interesting looking back on my journey is just how I think some of my behaviors weren't really viewed as red flags because I was male, right? So thinking about engaging in over exercising and being more mindful about the food that I was putting in my body so my body could have a certain build, right? That was not really ever viewed as a red flag. So let's just name that for what it is. Let's apply that to a woman, right? If they were restricting engaging in over exercising, I think that would receive attention. That would make some alarms go off of like, that's really concerning. And so I just think it's really important to be able to have that education and awareness of what are some of the signs and symptoms you need to be looking for in men and not just push it to the side, right? Because I think that leads to a lot of men going undiagnosed, right, with an eating disorder, as well. And so it just is so fascinating and interesting to think about some of those larger things, such as certain behaviors, that can really fly underneath a lot of providers' radars. And maybe not necessarily eating disorder therapists, but I'm maybe thinking more, primary care physicians and not being as well informed about male eating disorders as well.
Within the drive for pathology, I think men have a drive for fitness, where women have a drive for thinness, and then you have this societally acceptable mask of health and wellness that is having a lot of like pathology and concerns go under recognized and underseen, and a lot of people's pain, they're communicating pain through their body and their behaviors, but it's being reinforced or encouraged or celebrated. I want to make a conscious pivot because we were talking about intersectionality, and I really love that messaging. Because Maria's point of we talk about, cis, straight, white women. Well, okay, let's talk about gay men. And I've worked with a lot of clients where they end up using laxatives or diuretics as a way to purge, but also as a way to engage in pleasurable sex. So there's this dynamic that nourishing one part of your identity is using a diuretic or a laxative, but then it's also encouraging the eating disorder. So a question will come out at some point, but I guess maybe what is your opinion on that, or understanding, or even how can we engage in harm reduction?
Yeah, that's a great question. And I think what's so interesting too within this, I think it kind of goes back to, the narrative that you were talking about with gay men and HIV. I think one thing that is so still prevalent within the gay community today is this intense pressure to have a certain body, right? I think within the community, the ideal body is a very lean musculature build. And so I think it's so complex in so many different ways. And but I think a lot of it is still rooted in, especially within the community, a lot of your worth is based off of how you look, right? Thinking about all of the different, you know, communities within the gay community. You have your bears, you have your twinks, you have your jocks. Thinking about all of those different subgroups where, what I find so interesting is for a group that is looking for inclusion from the broader society, there's a lot of actually exclusion and discrimination going on within the community as it relates to and bodies and their appearance. But I think going back to your question too, it's so hard because I think what is rooted and why I think, a lot of gay men struggle with who they are as individuals still is attaching so much of their worth to their external appearance. And so I think they focus on a lot of controlling their external worlds, right? So thinking about the types of how much money they make, the clothes they wear, the house they buy, the car they drive, the way their bodies look as a way to gain that acceptance and approval from other people. And so I just find that so interesting that beneath all of this is just this deep desire to belong and be loved and to be accepted.
For like who you actually are, not just how the world tells
Yes.
you how you should present.
Yep.
I
Yes.
yeah, I love the way that you just kind of name that. And I think what's really sad too is that there's this focus on the external because the internal is also maybe like struggling because the external is getting almost like picked on and critiqued so much. So it's like it feels like a battle that you can't really even win. And then you're using different behaviors that are harmful, and then they're actually being praised. I assume it's like, wow, look at Eric's dedication. He is just really going for it in the gym, and he's like, I'm living with one of the hardest things ever. That just feels like such a dichotomy and a juxtaposition of what you're actually feeling. It makes me think of too, as you reflect on your time of when you lived with an eating disorder, were there aspects that you wish whether clinicians, coaches, loved ones noticed or paid attention to when you were going through this?
Mm, that's a great question. I feel like there were a couple of times when I was in the depths of struggling that friends and family had brought some concerns to my attention, but I was quick to come back with, I'm just being more mindful of what I'm eating and I'm just working out more and I'm probably not eating enough. And that was kind of, once again, it was just accepted. They're like, okay, sure, that makes sense. Um, and so I wish there would have been a stronger push for us to stay in the conversation and actually dig a little bit deeper. And I think it's interesting that I find myself reflecting as I say that out loud of just how much of a need I think there still is for just society as a whole of how do you have a conversation with someone you are concerned about potentially having an eating disorder. I think there still is a lot of fear. I've heard from, parents of former students of mine, even from parents who follow me on social media. How do I have this conversation with my child that I'm concerned about? Um, and I just think there is such a barrier to digging deeper when the language and the confidence isn't there to have these sorts of conversations. And so I'm thinking back on my journey, and I think that was for sure what the barrier was how do we have this conversation? Um, and it got to the point, though, I will say, in my own depths of struggling, my parents did finally give me an ultimatum. They told me either you need to start to gain weight or we're going to schedule a doctor's appointment for you. And that in that moment, I was just like, oh, oh no. Like this is something, it made me pause and zoom out. And I think it was that moment that made me realize what I was struggling with was something actually serious that I needed to begin to do some serious thinking and reflecting on. And so I told myself, like, if I go to the doctor and they schedule an appointment for me, they're going to probably admit me to treatment and I'm going to have to gain weight. And that's the last thing I want to do. So I was like, I'm going to take recovery into my own hands. And it was messy. It was not as non-linear as any recovery journey, could be. Of course, recovery just is not linear in any way, shape, or form for a lot of individuals. But I think for me, my recovery journey was very non-traditional and definitely something I do not recommend to anyone out there. And so I think if anything, as I share my story, I don't want people to listen and be like, okay, I can recover on my own without receiving professional help. It's actually quite the opposite. I share my story and so people know that they should yeah, should seek that professional help uh, as well. So I'm very proud of getting to where I am right now in my recovery, a little over 8 years now. Um, but at the same time, it's so hard to not find myself in the what ifs of what would my life look like now if I would have, gotten the formal help and the support for my eating disorder. But in those moments, it's easy for me to redirect now in those spaces. But at first, it was really challenging of, experiencing some shame surrounding not getting that formal help or support.
So, for men who might be listening, who may be struggling, but maybe the eating disorder label just doesn't feel like it fits them, what would you want them to hear or take away from this podcast as someone who's been there?
hmm I think there's a lot of things. I think one of the things that I would still love to continue to, demystify or debunk is that not just gay men have eating disorders, right? I think that's a narrative that's often talked about when we think about men and eating disorders, is just talking about gay men in particular. And I think sometimes straight or cisgender men, are left out of the picture, right? In that space. And so what I want, if there are heterosexual men out there listening to this conversation, know that you also can have an eating disorder, and that does not mean a single thing about your masculinity or about your sexuality. I think one of the things that there's a lot of stigma, I think, for men is it's going to demasculinize you by having that label of having an eating disorder. And I think there's a lot of fear about losing that part of themselves through the diagnosis or label of eating disorder. And I just want men to know that it will, if you do get diagnosed with an eating disorder, it will not take any of that away from you. I actually think it will do quite the opposite. It's going to make you stronger. It will make you a lot stronger as an individual, receiving the help that you need for yourself. And just know that there are other men out there who struggle too. You are not the only one. I think what we see so often when there is advocacy work on social media and awareness is that, there are a lot of women out there doing this work. And I don't think there are enough men out there sharing their stories. And we need men like you to come forth and to share your story. And I'm really trying to grow this community for you, for other men to enter into, to know that they have a place to share their story, to be seen for their own unique experience, because there is such a different perspective from being a male and living with an eating disorder or disordered eating. A lot of the men I work with in my recovery coaching, when I hop on them for a discovery call, they're like, I didn't know men out there existed like you, because no one is out there sharing their story. And so I just feel so called to continue to create this space, encourage other men to share their stories, to reach out for help, um, because you're worth it. You are worth it. And I will tell you that it is worth the work. It is worth all of the hard work you put into really, finding a little bit more safety within your own body and not necessarily needing to control your food, your exercise, your appearance in order to, be accepted by others. Because I really think this journey is all about how do we learn to embrace ourselves, right? And I think that's Maria going back to your open when we were towards the beginning of our conversation of how sometimes people transform into this new individual. Because I think once we remove the eating disorder behaviors, we're left with learning new ways how to cope with things like stress, life transitions, um, anxiety, a lot of these other things that require us to return and identify our own innate values, right? What do we value as individuals? And I think the more that we can align our own lives living according to those values, the more authentic we can find ourselves being in a space of less resistance. So, for men out there, just know I am with you. There are other men out there that are with you. And my messages in my inbox is always open, and I would love to chat if you feel like you need a space to land.
I can't follow up with anything better than that profound, eloquent answer to like what do we want men listening to hear, or if they feel like they can identify with this pathology. Um, I just loved how inclusive that language was. It's like, if you need this, then I'm here. If you don't need this, here we are. But I also love that you identified kind of the straight male presentation as well. And that's where it makes me really sad hearing you say the sentence like the singular chapter of eating disorders. I think everybody in this room or clinicians listening can nod in agreement that a singular chapter is not appropriate. One, to capture all the different landscapes of presentations. Two, to capture the necessity that is being the most deadly mental health disorder. So this is, such a chronic issue that I think has really, though, specifically impacted men negatively. And I hope that more conversations like this continue to exist, continue to grow, and maybe even not stand out because they just become a norm.
Yeah, if you are listening to this and you are a cishet male and you are looking for representation, the Seattle Mariners coach, or not coach, catcher, I believe, Mike Manjara, I think is his name. He is very vocal about being in recovery from an eating disorder. And I was thinking about how within sports, this is very common, particularly within men. So wrestling, you have weight classes and swimmers and track and field and even football players where I recently heard Jason Kelsey say that he is finally back in a weight in his body that actually felt good for him. And it's like, wow, like what were you putting your body through that when you found retirement, you finally felt good in your skin? I think that these things are coded in a different way that athletes and men, we just don't clock it as something that's concerning. So just thank you, thank you, thank you from the bottom of our hearts. Before we wrap up, any last comments from either any of us?
Yeah, I just think, going back, I think why we're having this conversation and why education is so important. Maria, you really named a really some important things, right? Making sure that men actually do get diagnosed, making sure that, well, getting diagnosed in general, to creating a space where men can recognize their struggles of maybe being an eating disorder so they receive help. They ask and seek it so they can get a diagnosis. And two, really, I think one of the things that you stated that is so important to let other people know with men and eating disorders is that they often um, receive help when they're at a much later stage of living with their eating disorder. And so that makes the recovery process a lot more challenging for those individuals. And so through awareness, through education, through more men sharing their stories, that's why we do this work. We want to have an effect on those three things that you shared right there. And so I will I mean, I feel so grateful to have these sorts of conversations with individuals like yourselves. And I'm so grateful that, you're wanting to create space to paint a more realistic picture for other providers of what it looks like for men to struggle with an eating disorder, the complexities that men experience if they are struggling with an eating disorder. So I think for me, I'm leaving this conversation with a lot of gratitude and appreciation, just for you two in general for asking such beautiful and wonderful questions and creating this space for me to enter into.
Well, thank you, Eric. Genuinely, thank you. Your voice, we like I'm already like, what month can we release this sooner? I'm like, Zoe, can we do a part two? This has just truly been wonderful. So we express the same gratitude to you, because this conversation matters. It always has mattered. I hate that it has taken this long, but I really, really, I'm leaving this feeling like a heart of gratitude as well for your willingness to share, because I know that you're sharing in a space that is not equivalent to like a woman with this history sharing. It's a completely different vulnerability there because of the lack of awareness, representation, and things of that nature. So thank you.
Thank you so much for joining us, Eric. Wherever you are, whoever you are, take a seat with us.